Do you have low back pain? Does it hurt more if you walk for a bit, stand for a while? Does it hurt less if you sit? Does it sometimes radiate down your leg? Are you over 60? If the answer to these questions is yes, then you probably have something called lumbar spinal stenosis, and this video is for you. What exactly is spinal stenosis? Spinal stenosis is basically arthritis in your spine. We all get this to some degree eventually. What happens over time is the intervertebral discs become less flexible and thinner. Here's what I mean by thinner. Imagine your spine is a stack of Oreo cookies. The cookie part is the vertebra, the frosting is the disc. When we're young, 20s, 30s, we have a stack of double stuff Oreo cookies. Lots of frosting, a thick, flexible disc. In middle age, we have a standard Oreo cookie. The disc isn't as thick as it once was, and it's less pliable. In our 60s, we develop a knockoff brand Oreo cookie version of the vertebrae. A little bit of frosting, the disc has gotten thin, and it's gotten stiff. In addition to this, some of the ligaments in the back of the spinal canal get thicker, and the joints behind the spinal canal, the facet joints, develop bone spurs. All of this together causes narrowing of the spinal canal, that's where the spinal cord is, up and down the middle of the spine, as well as narrowing of the little holes in the spinal column where the peripheral nerves pass through as they branch off and go down your leg. These changes lead to the typical symptoms of spinal stenosis: low back pain and pain radiating down the leg that generally increases with standing and walking, especially with bending backward and with lifting. And this is because the load that's applied to the spine with these movements causes these little nerve tunnels to narrow further and places more compressive force on those facet joints. How can physical therapy help? Well, we can't get rid of the arthritis that's already there. We can, however, improve hip and mid-back mobility, which takes some stress off the lumbar spine when we're standing, walking, lifting. In addition, we can improve core muscle strength, which can improve the lumbar spine's tolerance to stress, and therefore improve our ability to walk further, stand longer, lift more. Our first exercise is actually a stretch to the thoracic spine. I mentioned in the intro that improving mobility of the thoracic spine and the hips can help take some stress off the lumbar spine. And, as we get a little older, we tend to get real slouchy and stiff into kind of a bent forward position. So, take a towel, sitting at a kitchen chair, get the towel right behind kind of the middle of your back, kind of lower shoulder blades. We want to try to concentrate as much bend as possible where the towel is, not down here in the lumbar spine. Cross the arms and simply look up, bending back, trying to bend as much as you can where the towel is, not so much in the low back. We're not doing this. Notice my low back bending. This will tend to be painful with spinal stenosis. We really want the movement at the towel, kind of press into the towel, look up, bring the shoulders back, hold 10 to 15 seconds. Relax. We're going to do 3 to 5 of these. Our next stretch is simply a stretch into flexion or bending forward of the lumbar spine, which tends to be relieving for those with spinal stenosis. So this stretch comes in handy when you're having a flare-up of pain. Say you've been active, you've gone out shopping, you've done some yard work, the back's hurting. This will help simmer things down, at least in the short term. You don't need the stability ball, but it helps. So simply seated, hands on the stability ball, and simply bend forward, hold 10 to 15 seconds, come back up. And again, with those that have spinal stenosis, this really tends to feel good. So somewhere around 10 repetitions, there's honestly not a magic number. Do as many as you want if it feels good, if it helps relieve your pain. Somewhere around 10 repetitions, about a 10-second hold each. Our next stretch is a version of the one we just did in sitting. So simply lie down, grab one leg, simply pull up toward your chest, hold around 10 seconds. If this hurts your knee, simply grab behind the knee. Again, hold 10 seconds, 5 times per side, just switch back and forth. And again, this is particularly useful when you're having a flare-up of pain, again, maybe after a period of activity. Again, about a 10-second hold, 5 times per side. Before I demonstrate the next exercise, I want to remind everybody, if my content is helpful, if you find it interesting, click those like buttons, subscribe buttons, leave a comment. So our next exercise is actually a nerve stretch, specifically a stretch to the sciatic nerve. And this can really help decrease some of that pain that will radiate down the back of the leg. So simply lie down. On the hurt side, if it's both sides, just do both sides, but on the hurt side, grab behind the leg with the fingers interlaced, straighten the knee as far as you can, then flex the ankle, hold for a count of 10, then relax the ankle, relax the knee. We're going to do 10 repetitions. Straighten knee, flex ankle, hold, relax. Straighten knee, flex ankle. You might feel a pull go all the way up to your low back when you do this. Our next exercise is a plank. We're strengthening the abdominals, okay? So on the floor, on the toes, on the forearms, lift everything else up and hold this. If you can hold this for 10 seconds, that's pretty good. Try to work up to about 30 seconds over time. Do 2 reps. Now, if this is a little too much, simply hold from the knees rather than from the feet. So now my knees are on the floor, my elbows are on the floor. I'm holding everything else up in between. Hold this for 10 seconds. Again, 2 reps for 10 to 30 seconds each. Our next exercise is what we call a side plank. So on one side, knees are bent, hips and spine are pretty straight. They're in line. I'm not curled up in a fetal position. Okay? One hand on a hip and simply lift the hips up. Try to hold this for 10 seconds or more. Do two times on one side, 2 times on the other side. The next exercise we call the bird dog. This is one of the strengthening exercises for the core muscles, okay? So there's a progression that we're going to go through here. So step 1 of the progression, on the hands and knees, the take-home message is keep the spine and trunk really still. I'll show you what I mean. So step 1 of the progression, lift one arm, hold for a few seconds, switch arms. As you lift the arms, you'll feel your stomach muscles engage a bit. Now, what do I mean by don't move the spine? Don't twist the spine, okay? Don't arch the back. That will tend to hurt. So if you can keep the spine really still, you're not shifting your weight back and forth as you lift one arm, then you can graduate to the next step, which is lifting one leg. Again, keeping the spine real still. Okay, I'm not arching my back. That's a no-no. My back's not twisting toward the side of the lifted leg. Okay, I'm keeping real still in the trunk. Now, again, if I can do this reasonably well, I can graduate to the last step, which is opposite arm and leg. Hold for a few seconds, come down. So if you can do about 20 of these, that's pretty good. You can certainly add repetitions to add intensity. You can add hold time to add intensity. But somewhere around 2 to 3 sets of 20 repetitions is pretty good. And again, the take-home message is the spine stays really still. I'm not arching, I'm not twisting as I move my arm and leg. Our last exercise is a stretch for the hip. So kneeling on one knee. Now, if this is kind of painful on a knee, you can kneel on a pillow to cushion that a bit. You're trying to stay up tall. You're simply going to lunge forward a bit. You should feel pull in front of this hip. Now, don't bend back. Avoid bending backward. That'll tend to aggravate spinal stenosis. Stay up tall. The other thing, if you kind of clench your butt muscle on this side, that will cause a little more stretch in the front of this hip without bending the spine as much. Hold this for about 20 to 30 seconds, then relax. You can use something for balance, a chair, something like that. Again, clench the butt muscle, lunge forward a bit. You'll feel pull in the front of this hip. Hold 20 to 30 seconds, 2 to 3 times per side. That's my home exercise program for spinal stenosis. I hope you found this video helpful. I hope it helps you get back to what you love to do. Click those like and subscribe buttons, and we'll see you in the next video.